Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Guillermo Ruiz.
Hello everyone, my guest today is Dr. Noah Koyer. Dr. Noah has managed the Family Chiropractic Center of Bayonne for the past 16 years with the mission to guide people to achieve their own innate beauty and good health. His patients range from infants a few hours old to enlightened 99-year-olds. In 2014, Dr. Noah co-created a new business with two of his closest colleagues who shared the same desire to help humanity live a healthy lifestyle through a think tank organization called Beyond Your Wildest Genes. Dr. Noah was the co-host for the Pain Relief Project Natural Solutions That Actually Work and the co-host for the recently released longevity and anti-aging project Living Healthy, Wealthy, and Wise. You can hear Dr. Noah regularly on the Beyond Your Wildest Genes podcast found on iTunes. He has been married to his beautiful wife Kerri for 16 years and has two incredible children. Also, I received a report from my podcast hosting site, and they informed me that the podcast has been a big hit in Europe. I have listeners in Sweden, Spain, Belgium, the Czech Republic, England, and many other countries. Thank you for your support. If you enjoyed this podcast, share it with your friends and visit my website, 3030strong.com. I hope you enjoy the show. Hello everyone, I'm here with Dr. Noah Koyer, and he interviewed me for his podcast, Beyond Your Wildest Genes, a couple of weeks ago. And I wanted to return the favor because we had such a great conversation. So, Dr. Koyer, could you introduce yourself to my audience?
Hey, thanks, Guillermo. I'm so happy. I'm honored. I'm so very pleased to be on your podcast. I interview quite a bit of people, and it's always nice to be, on the other hand, getting interviewed. So thank you very much.
Yeah, no, and we just hit it off, and then I actually was introduced to you by my friend Allison Crystal.
Yes.
And when you guys were talking about treating kids, you said a couple of things about adjustments for like mental situations. But before we get into the deep of it, what's your hero story?
Yeah, let me. That's great. It's a short story that I've shared several times, and it never gets tired for me to share it. I was a young kid. I was thin, braces, glasses, not super athletic, pretty bright, but I was always sick. Suffered really badly from strep throat, ear infections, took antibiotic after antibiotic, multiple courses a year for multiple years. And that all changed one day when my mother was watching me play baseball, and she was sitting on these cold aluminum bleachers, and she was complaining about her low back. And the lady sitting next to her just happened to work for a chiropractor. And she said, Eve, you should go see my chiropractor. He'll help with your low back. And she took that action step, and she went and she got adjusted, and her low back resolved. But what that chiropractor did was tell her what the true story of what chiropractic is, that the body's self-healing and self-regulating, that the nervous system controls and coordinates the body, and that if your spinal column is healthy, your nervous system is going to be healthier and you're going to be a higher functioning person. So that sparked her enough to bring me, my brother, my sister, my father to this chiropractor. I'll never forget, getting on that table the first time, turning my head to the right, turning my head to the left, getting my first adjustment, hopping off the table and looking at my mom and saying, wow, that's what I want to do for the rest of my life. But maybe more importantly, what I realized over the next 3 months, 6 months, 9 months, multiple years is that after that first adjustment, I never had another strep throat infection again, never had another ear infection again, and, never took an antibiotic, since I've been about 10, 11, or 12 years old. So, my hero's journey started with me being a relatively sick young child, not sick with a massive disease, but chronic infection sick. And then meeting the chiropractor, getting that first adjustment, and me essentially becoming much healthier, and then also giving me a sense of purpose and direction for the rest of my life.
That's amazing. And for our audience members out there that might not be familiar with what would be what was the adjustment doing to you to prevent those throat infections or those recurrent infections?
Yeah, it's a great question. Most people think of chiropractic because we're poor educators by nature, but most people think as chiropractic as something or a treatment for low back pain or for headaches or someone who was in car accidents. And the truth is that I take care of people that are in those scenarios every single day. But what people don't know is that chiropractic was founded in 1895 by a person named D.D. Palmer adjusting a deaf janitor, and that janitor regaining his hearing. So what happened to this janitor and what happened to me was there was a bone or multiple bones in his spine that were misplaced, that were putting pressure on the nervous system and putting tension or decreasing the tone of his nervous system, affecting how well he was hearing. Well, the same thing was happening to me. I had some misalignments or subluxations, as we call it, in my neck, that once they were corrected and they released that tension or that adverse tone on my nervous system and on those nerve roots and on those nerves, it allowed my nervous system to function better. It allowed that tissue that those nerves reached to function better. It allowed my lymph system to function better. And it just allowed my body to heal like it was made and intended to. So, and that goes for anything. For me, it was strep throat or ear infections. For others, it's migraine headaches. For others, it's low back pain or sciatica. For others, it's stomach indigestion. It's everything and anything. We don't, as chiropractors, treat anything per se, but what we do is we allow the body to function better and allow the body to heal itself better. And that's first and foremost.
When it's a funny story because, I'm going to naturopathic medical school, and one of the things that we do, we we learn physical medicine. And when I was moving from Florida to Arizona, I bought one of those pull-up bars that you put on the door frame. And I didn't have a gym membership. We took a month, and we traveled through the South, and we went to visit my parents, we visited some friends. And I was doing pull-ups every day. And then I stopped having feeling on my pinky and my fourth digit. I stopped having feeling on those. And I remember sitting, it was Q2, Dr. King's lecture. She was telling us about thoracic outlet syndrome. And I'm like sitting there thinking, wait a minute. So the reason my pinky is tingly is not because I'm getting old. It's maybe because my scalenes were put some cervicals out of alignment. So on Wednesdays we get to practice on each other, because that's what medical students do. And I go to Dr. Nick, who is the head of the physical medicine department, and I say, Dr. Nick, I think I have thoracic outlet syndrome. He looked straight at me and said, "You're full of shit." Because medical students, we are chronic hypochondriacs. But sure enough, he adjusted my neck, and they did Adson's rights, which are tests to test for thoracic outlet syndrome. And sure enough, after the adjustment, I felt feeling segmentally coming down my arm, and that's when I was like, I need to get really good at this because it's just an added benefit for my patients. It's something that if a patient comes in because they slept the wrong way, that is something that I can do in 5 minutes that it's just going to make the life of my patient just so much better.
100%. Think of it this way too, Guillermo. You know that a nerve, and for your audience, think of a nerve as a gigantic, bundle. And inside that nerve, there's all different sorts of bundles. And some of those are nerve fibers, and some of those are function fibers, and some of those are vibratory or heat sensors. You can have compression on a nerve and it cause pain down your arm. Or you can have compression on a nerve that's just decreasing function of that tissue that it reaches, and you have no idea it's happening. So the structure and function of your spine is so crucial, whether you have pain or whether you have no pain, because you can have pressure on a nerve and it decrease function without zero pain. So it's important all the way around.
And especially now in this sterile environment that we're living in, where we have this lack of, or this absence of proprioception. And then when that little proprioception you're getting is not optimal, then the effects of the lack of proprioception are going to be exacerbated.
Yeah, I mean, one of the ways I explain chiropractic is think of it as a computer. And the same thing can be said for naturopathic medicine, your specialty too. Most people are familiar with the term GIGO or GIGO, garbage in, garbage out. If you put the wrong information into a computer, you're going to get the wrong information out. Well, if your body is perceiving the wrong information, it's not going to put out the right output, right? Just like if you eat the wrong food, you're not going to get optimal health. If your body or your nervous system is not functioning properly and it can't perceive the environment around itself, the output is going to not be what it needs to be. So like you said, proprioception is really, really, really important. And the way you perceive the environment is so crucial into how healthy you are.
So we decided that this was our course of action, okay? And before we started this interview, we were talking a little bit of shop, about podcasts and the such, and then I said to you that I didn't know that by going to naturopathic medical school, I was going to end up getting a MBA, because I really like the idea of this cash-based system way of treating people, because I don't like the hidden economy of insurances, but it is a high risk, high reward kind of a situation. For all the people out there that that are right on the sidelines looking in, and they can't wait to get their feet in on the field, what are some recommendations do you have from a business aspect? We have the passion, we want to help the people, but maybe they're scared that they might not be able to pay their loans. They're scared of how they're gonna make ends meet. What are some, of your biggest needle movers for your practice? You have a pretty successful practice.
Yeah, well, okay. Well, there's two things. The first thing was what I had when I first got out of school, and that I still have, but it's gotten a little bit on the wayside. But when I first came out of school, chiropractic school, I had an enormous amount of passion. I joined every single group I possibly can: Toastmasters, Rotary, Lions, Chamber of Commerce. And I talked to people and I shared my story. And when people came in as new patients, I got their family members involved, and I told them and I told them and I told them again and I told them again and again. And this passion for natural health and this passion for chiropractic and the passion for how the body was designed to be healthy and made to be healthy, grew my practice naturally and exponentially. So that was really important in the beginning. Just as important is, and this, I mean, Christ, you're speaking at Paleo FX.
Yeah, that's so exciting.
Yeah, yes, you need to be able to get in front of as many people as you can, and you need to share your passion and in front of many people as you can, and that does mean things like social media, but it also means one-on-one, one on a few, one on a lot. You need to hone your speaking skills and learn to conquer that fear of speaking. I don't know how you conquered your fear of speaking. Maybe you never had it, Guillermo. I was gonna say, how did you do it?
Okay, so when I came to interview to SCNM, they have a program called the Ambassadors, and what the Ambassadors do is, whenever you have a student for a day, you get to spend some time with real students. So as soon as I was eligible to join the Ambassadors, I became an ambassador, and every chance I had to do a tour of the school, any chance there was a new student, every chance someone would give me their ear, I began crafting a pitch. And little by little, I have certain stories that I tell, when I'm at a specific part of the school, or ways. And I was testing all these stories. I was like, whenever I talk about, one of the most powerful things that I think that I talk about is how you don't have to be a doctor to be a healer. That a healer can be your health coach, that helps you navigate through the medical system. A healer can be your mom that decided that that said we're gonna start eating real food, and that's the actual person that's healing you. The letters after your name don't matter, and that little bit of information was crafted while talking to people that were visiting the school. And I would look at the reaction, and I would start seeing what was hitting and what wasn't. And little by little, by trial and error, some things don't spark attention, and other things do. And little by little, you start creating your story, and all of a sudden, now you can get in front of a crowd, and what works and what doesn't.
Right, right, right. For me, I look back as a child. My father put me in situations where I was talking to other students, whether it was my rock and fossil collection, or whether I was talking to his students or sharing. So my father put me in these positions when I was little, and he probably doesn't even remember he did it, or maybe he does, but that helped me at an early age. And I'll never forget sitting in chiropractic school and one of the professors saying, you need to join Toastmasters because you need to learn how to speak. And right when I got out of school, I joined Toastmasters, and for 5 years, I was, competitively speaking to Toastmasters, preparing speeches, and really honing my skill. And now, I'm nervous when I speak. And so I guess the biggest venue that I spoke at was at the Functional Forum in December with your friend Allison Crystal. But at this point in my life, because I've practiced speaking, whether it's in front of 2 people, 10 people, 20 people, or 1,000 people, even though I'm nervous, I know that I could perform and I'll deliver a great presentation. So early on in your business, you need to have an enormous passion, and you absolutely have to be able to speak and present in front of people.
And that I think a lot of people come in with the enormous passion, and then the programs are hard. It's not like medical school light. You're taking 27 credit hours at some points in one quarter, and they get beat down, and then the passion tends to fade away. And I see that a lot with some students. Just remember why you went to medical school. Just remember, that person that pushed you, whether it was illness or maybe inspiration, like in your case. Just remember them, and just continue trucking on. Everything is going to be fine. At the end of the day, you just want to help people.
Yeah, and you can never lose that. You can't get bogged down in school. Even school, and you want to perform well in school, but school is ultimately a means to an end. When you finish school, that's really just the beginning, right?
That is just the beginning. Yeah, and I'm getting nervous.
Yeah. You got a great foundation, for sure. But as I grew and developed in practice, the thing that's changed my life, day in and day out, week in and week out, month in and month out, year in and year out, was just about I think it's going on 9 years ago, I became a part of an accountability group. And this accountability group consisted of a bunch of chiropractors and entrepreneurs from the United States and Canada. And the group has morphed a little bit over the years, but we meet every single Tuesday morning at 9 a.m. via the phone. We have a free conference line, and we go over our wins and challenges, both personally and professionally. We state our accountabilities for the next week and for what our accountabilities were the prior week. And this, without a doubt, has made the biggest difference in my life, business-wise, personal-wise. It's changed everything I do. In fact, 2 of those people, well, 3 of them, including myself, in this accountability group is where Beyond Your Wildest Genes came out of. So I heard some Michael Fishman speak, who's a behind-the-scenes guy, and and he was talking about how well Tom O'Brien's gluten summit did, extraordinarily well. And my wheels started getting turning, and I went to one of my partners and said, Dr. Mike, we need to do something like this. And he went to another person in the accountability group and brought her in, and we came together. We formed this little think tank, and 3 years later, we've hosted 2 successful summits. We have a rather large podcast. We created our first course. We're releasing our second course in a few months, and all out of this accountability group that we created 8 years ago and have committed to every single Tuesday at 9 a.m.
That's fantastic. And it's for any aspect of living. I don't even want to say health. Habits are so important, and it's the most difficult thing to change within a patient, because even if you're just prescribing prescription medication, which is the easiest intervention for something, they'll eventually ask you, so am I going to be taking pills for the rest of my life? Because no one wants to do that, and that's the easiest intervention. When you're talking to people about, okay, you're going to have to change your whole life, it really starts with baby steps. So whether it's going to bed at a certain time, whether it's cooking 3 meals out of your own kitchen, or whether it is meeting with some like-minded people once a week and sticking to that, that is going to create change that is positive, that is going to bring in more than what you're putting in.
Absolutely. So, maybe you have an accountability or a mastermind group. I'm not sure, Guillermo, but if we use you as an example, for sure, I would say, maybe find a bunch of naturopaths or a bunch of functional medicine docs, email a bunch of them, find out who's interested, get 4 to 5 people, and make a strong commitment, and only get people that are committed. And you're going to meet once a week for 1 hour and go over your wins and challenges professionally and personally, and then create your accountabilities for that next week and stick to it, hold to it, make that habit. And I'm certain it'll change your life in the course of your business, the course of your practice, and the course of your family life, and everything in between.
That's exactly it. Having that routine, having that, and those peers that are like-minded, that is just so important. Now, let me ask you, what other habits, what other, routines or accountabilities do you have with yourself? I know you're a really big nerd of the yoga.
Yes. Yeah. So that was my first thing that I put down, some of the healthy habits of myself. First, I'm a huge fan of yoga. So from the physical aspect to the mental, emotional benefits, and it's the sister science of Ayurveda, which literally means science of life. And you being a natural, specialist, you have to appreciate what Ayurveda and what Ayurveda brings to the table. So I am a huge, huge fan of yoga. It's something that I make a commitment to minimal 3 times a week. So huge fan of yoga. Put it in the books. I suggest joining a studio, and even if your choice of or the way you exercise is much heavier lifting weights, or you're a long distance runner, integrating yoga into your routine will make you better, and anything you do mentally, physically, and emotionally as well. Other healthy habits, learn to be your own best personal biohacker. Think out of the box, try different things, learn, and see what works best for you. I'm still in that process. I'm still figuring out what my best diet is, what my best supplement regimen is, who I need on my healthcare team that's going to get me to that direction. And that leads me to the third habit. You want to surround yourself with great people, but you also want to surround yourself with a great, true healthcare team. Whether someone on your team is an expert in botanical health, everybody needs a chiropractor, an acupuncturist, a naturopath. Surround yourself with people that can help you reach your greatest health potential. And it's my business. Health is my business. And I'm fortunate to know a lot of people in this natural health realm. But for example, my father got severely injured about 8 weeks ago, spinal cord injury, paralysis, the whole thing. And I was able to contact an expert in essential oils. I was able to contact an expert in functional medicine and chiropractic neurology. I was able to reach out to an expert in a mushroom expert, basically, a medicinal mushroom. And we got to put together a program where my dad healed rapidly, about 70% in about 3 weeks. And now we're working on reclaiming his last 20 to 30%. But because I surrounded myself with these types of people, they were available to me at a moment's notice, and it really helped my father, but it helps me as well. I have a healthcare team. I'm sure you have a healthcare team, or people that are your mentors, whether you can reach out to them or they're virtual, or whether you can just read their material. Create that group around you to help create the best person in you, to push you forward. And it doesn't only have to be health too. It could be mentally, emotionally, spiritually, so on and so forth.
And I'm sure there is some reciprocity. And if one of the members of your healthcare team had an injured family member, you would reciprocate and you would be there for them too.
100%. Let's use our example. Let's use our relationship as an example. You need a good referral to a great chiropractor or a chiropractic neurologist. I'm going to help you out in an instant. If I need some information on botanical health, botanicals that you're an expert in, I expect you, and you would respond right back in an instant. And that's the way this whole community needs to work to change this broken system that we live in right now.
Yeah, and I think the time where the nurses had to stand up whenever the doctor showed up to the hospital are long gone. I don't think that the letters after your name don't matter, and there's specialties, and there are niches that we are going to cover, but the person in front of us is not a niche. The person is a whole that has to be approached in so many different ways, and in order for true health to be delivered.
Totally agree. My last healthy habit that is still a struggle for me that I put a lot of effort into is sleep. Without sleep, nothing works right. You're more irritable, you're less functional. Nothing works the way you think or planned it's going to be. So put a huge emphasis on sleep. And if you're not a good sleeper, learn how to become a better sleeper. And that's something that I put a lot of effort into, that I haven't fully succeeded yet, but that I put a lot of effort into doing.
I'm on the same boat. I preach to sleep, but, with school and projects, and, it's hard for me to get my 8 hours every night. And hopefully it's going to change once I graduate, but I'm trying. Now, let me ask you, for my listeners that have kids, I know you have kids and you talk about them on your podcast. What are some of the, I'm going to start a revolution, and I'm going to try to get all my paleo peeps and all the people listening to start requesting the banning of kid menus at restaurants, because there's no such thing as kids food. They should be eating, very similar to when you go eat a steak. They should maybe having steak cut up in tiny pieces. But how do you approach, the picky eaters? How do you approach, trying to get your kids from a start, with a wider palate than bigger than chicken nuggets and French fries?
Well, let me be perfectly honest with you, is what I have done personally has worked fantastic for my oldest son and has been a complete disaster for my youngest son. But I keep trying. And what it comes down to, and this is one of the things I had written down somewhere else for our interview today, is you have to talk your talk and you have to walk your walk. So my oldest son, he sees the way I eat. He sees that I set out my specific supplements every day for the entire family, and he gets it, and he'll try anything. He'll try the chicken hearts and the liver, and he'll try the mashed rutabaga instead of the mashed white potato, and he'll try anything he'll eat the sushi and the raw fish and and the miso soup and the seaweeds. He'll try and enjoy anything, and he sees it because I fostered that within him from day one. Now, I can't tell you why my younger son hasn't joined the bandwagon, but
How old are
kids
your
are all
kids?
different. Almost 12 and 7.
Okay. And so they're not, they're getting a little bit of control over their lives at this
Yeah,
time.
absolutely. Particularly the 12-year-old, absolutely. But I suspect that my younger son will hop on board too, because he's starting to realize that he doesn't function as well when he's not eating the right foods, or not eating enough, or not having the right mix of protein and carbs and fats and so on and so forth. He knows his body, his brain doesn't function as well when he's eating poorly, and he's getting it. He's getting it. But I think essentially, you have to cook with your kids. You have to go to the supermarket with your kids, allow them to pick out and watch you pick out those healthiest foods and those better choices, and just keep showing them that they function better, that they live better, they're better athletes when they're fueling their body properly. And I think it's just something that you have to continue, push, but it's got to start with you. You can't teach your kids how to eat right if you're not eating right yourself. That just doesn't work. That just doesn't happen.
Weird question. Do you have a sweet tooth?
Oh my God. I have a massive sweet tooth, particularly for chocolate and dark chocolate. But I've learned to tailor that back a little bit, quite a bit.
How'd you do it?
How did I do it? I think in my case, it's just sheer education, knowing that sugar and sugar is probably enemy number one, and you have to really reduce it as much as you possibly can. I use a little bit of stevia. I use a little bit of low-hanging fruit. I use those things to kind of break that habit of my sweet tooth, but that's a constant struggle for me too. But it's becoming less and less and less and less and less and less.
What about your kids? Do they have sweet tooths?
They do, and I try to support their sweet tooth or their sweet teeth with the best options possible. Full fat creams, higher quality ice creams that don't have a bunch of artificial sweeteners in it. The darkest of dark chocolates, fruit, things that do have sugar in them, but it's just better options. It's always about better options. I believe you have to allow your kids to be kids, but there are definitely better options within their options that are going to support the health of their bodies much better. You can choose to buy really poor quality hot chocolate that's sweetened with aspartame, or you can buy really high quality hot chocolates that's sweetened with xylitol, that's raw organic cacao, that really feeds their body healthfully. So there's always a different option that is going to be a better option, and you just got to continually push that needle forward to choosing better options for your kids, always, over and over again.
Yeah, it's hard for me to talk about sweets because I don't have a sweet tooth. I prefer, the umami flavors. I will have some ice cream every once in a while, especially after barbecue. For some reason, after eating barbecue, I want a cup of ice cream. But it's like, it's very easy for me to say to people, yeah, just don't eat sweets, because I don't have that brain connection that makes me crave sweets. And I don't have kids, so you're the perfect guest because I can get to talk to someone that knows about these topics and help my listeners guide their lives, because it's tough out there.
It's all about options. It's all about consistently choosing the best option possible.
Yeah, and when you make the right choice more times than not, you're gonna end up in a better place.
Yep, I agree.
Now, do your kids get adjusted?
Oh, of course, yeah. So we see a lot of kids in our practice, and they get adjusted on a regular basis. We see a lot of kids in our office, and it's just like them eating the right food. I want to want them to be as healthy as possible. And I know a higher functioning nervous system is going to allow them to perform better. So I check and adjust them on a regular basis. Absolutely. 100%. Since they were born, since they were in the hospital, 1 minute after each one of them were born.
And what are some of the things that kids are coming to see you for?
Oh, it ranges everything from just wellness checkups, just to make sure that they're developing properly, that their spine is developing properly, that they don't have any strange curvatures or misalignments or fixations in their spine, to chronic infections like strep throat and ear infections, all the way up to things like ADD, ADHD, and autism as well.
Wow.
I have seen kids that are speech delayed, many kids that are speech delayed, that are going through all the different therapies and they're improving. But the second they get their nervous system turned on and they get their first adjustment, everything changes and they start speaking more, learning new words more rapidly. Just like I said from the beginning, they were not perceiving and getting the proper information from their environment, and therefore their output wasn't proper. The second you adjust their spine, release the tension in their nervous system, they're getting better input from the environment, and therefore when they get better input from the environment, they're getting a better output. So anywhere from just a normal adjustment just to make sure they're functioning at their best level and developing, all the way to things like autism and ADHD and anywhere in between.
It's amazing how, you can have the full gamut, people that are coming into you because they want to be able to get more weight on their back when they're doing the squat, to a kid that really needs help beyond what the parents can give, with some of these disorders. It's fantastic, the stuff that we can do as practitioners. And I'm so happy to have chosen a path that wasn't going to pigeonhole me into just a one set of the population and be able to take care of these more complicated cases.
Right, like in what you do, correct me if I'm wrong, Guillermo, there are certain botanicals that are, their main job is just to strengthen the immunity or strengthen the function of the body. And then there's ones that are specifically targeted that can be used to target cancers or different conditions. And it's nice to have both of those toolboxes, right? That you can just focus on keeping the body as healthy as it can, or when the body is sick, you can return that body to a state of health or wellness.
Yeah, so optimization or targeted therapy, and that's amazing. Well, Dr. Koyer, what a great conversation we've had. Where can people reach you? Can you talk a little bit about your podcast?
Yeah, so I have two hats. One, if you're looking for a functional medicine based chiropractor and you live right outside of New York City on the Jersey side, then that's my chiropractic business, and that's www.fccofbayonne.com or www.fccofbayonne.com. I will respond to Facebook Instant Messenger, so you can like me on Facebook and send me over a message. I'll definitely respond there. And in my other hand is the health and education business that I have with my two partners, and that's Beyond Your Wildest Genes. We hosted 2 summits. We created the podcast Beyond Your Wildest Genes, which you were a guest of, and most of the big names are on it as well. And we created a men's course, and now we're creating a women's course that's going to come out at the end of May. And that's www.beyondyourwildestgenes.com, just as it sounds.
So much information on your podcast. When I saw the list of the people you've interviewed, I kind of freaked out a little bit, and because I had been on Rob Wolf's podcast before, and that was pretty big, and then I go look at your list, and I'm like, whoa, man, I'm gonna go talk, and I think it was a good conversation that we had.
Yeah, absolutely. It's my pleasure. Thank you very, very much.
Well, Dr. Koyer, thank you so much for the interview, and I'll be talking to you soon.
Yes. Stay in touch, pal. I appreciate it greatly.
Thank you.